And now
let's
I'm going to
system
turn
on.
on the brain. There we go. And then, no.
No.
Okay. No. And then what's next?
Med surge.
Med surge, the third one. And confirm.
Mm-hmm.
And then now
Which
channel
module?
select.
A? Okay. Because that's where your tubing is.
Channel select. Basic.
Now, some of the instructors are okay with basic infusion. With me, when you're working in the hospital, they have to use guardrails. And the only time the basic they use when it's urgent.
Okay, so guardrails.
So, for fluids.
Mm-hmm.
So it's
Guardrails,
whatever
IV.
your instructor wants you to do. Now, what fluid do you have up there?
I have a half normal
And
saline.
so you're going to select there. The 0.45 is considered half.
Mm-hmm.
And you
Is
answer
this
the
correct?
question.
Yes. And then
And
now,
what's the rate?
100.
Okay.
Okay, rate.
But that'll be on our doctor's orders. when we
Yes,
get to find out.
absolutely.
Thank you.
And what's the volume? You have to do the volume.
The size of the bag. Should we
It's
put?
a liter bag. So remember, the instructor tells you to set it at 900.
900.
Just in case, once it starts to beep, you go in the room and check it. That'll give you time to
To
go
replace
and get
it
the
and
IV or, you know,
Okay.
because you don't want the fluid to run down to where the module is, because you have to change the tubing.
So
So
VTB.
volume to be infused, how much is,
900.
okay?
So is
you're
it the
gonna-
third one? Wait, what's the first one here?
You're doing rate,
Oh, okay.
and you,
Oh,
it's
and
telling you primary
Oh,
solution,
okay. See,
okay?
there we go.
And then
I got
volume to
confused
be
me.
infused, we're gonna do 900.
Okay. And then now start.
Mhm.
Okay.
Okay, now, at this point, I'm sure it's on the Rubik's, you have to confirm, have you, checked your IV to make sure there is no redness,
Yes.
swelling?
Yes. So I would have to check pain, swelling, redness, and patency.
Patency, so how do you
Patency.
do that? How do you check for patency?
I don't know.
You get a flush and you aspirate and flush.
Good girl. So, aspirate, so what you're gonna do, you're gonna clean off the blue hup, okay? And this you can put on pause now. Because it's gonna keep beeping.
Oh, do we
So,
pause the other one?
okay, so pause. So now you're checking your IV and there's no signs of infiltration. Patency, so how are we gonna check for that? Aspirate,
With a
how much?
Oh, just like 2 to 3
Just a
milliliters.
flash. No,
just a
that's
flush.
flushing. So, first thing you're gonna do, normally if flushes come in a 10 cc syringe, you're gonna get rid of at least a cc.
Okay.
Because if it's a full cc, full 10 cc's, you're not gonna be able to pull back. So I get rid of a cc, and then after cleaning the blue port, then I connect it, and then I very gently pull back, and all you need is like a little flash, and when you see that, you can flush forward slowly, about 3 to 5 cc's.
Awesome.
And
Okay.
that's confirmed that is working.
Okay.
So
Beautiful.
now you can hook up your main IV. So, because you've confirmed that the
That it's
line is patent and working. So you're gonna wipe the blue port again and you're gonna connect that.
Okay. So I will take this off, correct?
That's correct.
And then I'll wipe the patient's
alcohol.
port and then connect. So now this is connected.
How long are you going to connect after you clean the alcohol?
10 to 15 seconds.
Yes.
15 seconds.
Yeah, 10
Okay.
to 15 seconds.
10 to
when it's
15
dry.
seconds.
And then you're going to connect that, and you're all set on your primary. Now, you're going to go to your secondary.
Okay.
Okay?
So secondary bag. Okay.
And so you have your secondary tubing, and you have your bag here. While this is running nicely.
Okay.
Okay? And you don't have to worry about that.
Okay. So open this bag.
And see how on the module it tells you? Now, it's still on pause, so what do you want to do?
Restart? Or no.
Restart. That's
restart?
right. Because whenever you're setting it to a different, I guess, a different mechanism on there, you have to reset, okay?
Okay.
So, primary is
Is
working
good.
fine.
Okay.
You're good.
So now I'm basically gonna do
And
the
remember, the first thing you're gonna do is
is
what?
clamp.
Clamp.
So clamp this. I don't need to do this one, right? The green one.
Well,
Just clamp that.
this
part?
step, just
Okay.
one.
All right. And then now I'm going to take this off.
Did you have something on your thing there? This one? Did you have a cap on that? Okay, that's okay.
Okay.
So take
So
that
take
off,
that off.
and
And
while
then
you're holding that up,
while I'm holding this up,
Yeah.
oops, put this on. Okay. And then
and you can now, what you're gonna do, you're gonna flush so you see your clamp, make sure you hold on to this. Now, I'm not gonna hold it for you. So,
now
don't yet. Make sure you hold on here. Okay. So. See, when you become a nurse, you learn how to multitask.
stuff.
See this? Like that. Oh,
Okay.
what didn't we do?
Prime
Oh.
Prime it. Half full,
there we
and
go.
then I'm going to.
Can I just go ahead and hang it while I'm doing this? or
No, you gotta flush it. The
Oh, okay.
tubing is too short, and this is gonna go everywhere. And then you
Right.
gotta flush the air out.
Okay.
So, you have to do this down here. So,
Okay. Can I try?
yeah, I'm gonna let you do it. Okay, go ahead.
So holding on to this. Now I'm going to
Pay attention, because you wanna get quick control. You don't wanna lose your drug.
Right. So
Close
now I'm
it,
closing
close
it.
Close it. You don't wanna lose your drug out of there. So you're gonna do it slow, not quick, because if you do it quick, you're not gonna be able to close that clamp fast enough, and you're gonna lose.
So just
half
a
of
little
your
bit.
drug. Yes.
And then once I see
Yeah.
it dripping, then close it right away.
Absolutely.
Okay.
Now
so
you can hang that,
I hang this.
and where is that gonna go?
Which one? This. It's gonna go to this.
The secondary port.
Oh.
Where is the
It's up there.
secondary port?
I don't
It should
know.
be up there.
Where?
Check so grab the line and see towards the top. There should be a. There you go.
That is
Yep.
called your secondary port. And what are
Okay.
you gonna do to that before you hook
We're
it up?
going to alcohol.
That's correct.
Okay, alcohol.
And then you're gonna connect that. And you're doing good, because you have your main line running, and you don't have to worry about that. You know, everything's fine. Okay, so you
So
connected
alcohol,
that.
Connect,
Okay.
and then lower
Now-
this.
You're gonna lower that.
Okay. Um. And
So now,
oh shoot. Or should I just put it on the other side?
be neat, like you're cleaning your bedroom. Always, here, let me show you. Don't have that going back like that. You wanna have that there. Always try to be neat. There you go. Now, we want to start our secondary. So, what are you gonna do?
So now I'm going to
Channel
channel select on this one or this one?
No, that one,
Oh,
channel
okay.
select.
Channel
There's
select.
nothing going through there.
Oh, that's right, because it's connected to here.
Everything is going on one
Right.
side.
Okay, channel select, and then secondary,
Yes.
secondary.
And
And
let's just
then-
select the top one. And it's asking you which drug. We can select the top one.
Select, and then
Just select that there.
select it again.
Wait. I'm sorry. That one.
Okay, the
you
second one.
selected one. Okay, and you're gonna look at that and answer.
Is this correct? Yes.
Mm-hmm.
And then everything is good, and now I'm
Mm-hmm.
going to push next,
It tells you there, next to confirm.
and then the duration.
Yep, the duration will fill in everything. So let's say 1 hour. Select duration.
I'm getting confused on which of these buttons right here.
Duration is right there, right
Okay.
next to it.
I can't. Okay.
Oh,
Oh,
you know why
That's
the
because I
pump is
was-
so low. Now let's say duration 1 hour. So,
1,
that's
0.
not, yeah, that's
Zero.
it,
Okay.
okay? Now what's next?
Start.
And checking line.
Mm-hmm.
There you go. Or it's saying occluded. So so if it says occluded, what are you gonna do?
Check if the line's locked anywhere.
Yeah, so do that. Because once you attach your secondary, you can open that up. It's not going anywhere until you start it. And what about the primary line?
The primary line. The primary line is. There we go.
Okay, and whenever you have to make a change, you always do a restart.
Restart. If it says occluded, and then I fixed everything,
Yeah,
and
then you
now
have
restart.
to restart.
Okay.
There you go. See it's coming up? It tells you the drug name and the dose. And that it's a secondary.
Perfect. All right.
Alrighty?
Thank you so
Good job.
much.